Okay, so welcome back. Good morning to all of my dear viewers. And today's session we are going to discuss a very serious issue of our community, and you know that it is a rape. So today class we are going to discuss how the rape examination of victim is conducted. So the examination of rape victim is conducted under the 144 BNSS. Rape victim examination is conducted under which BNSS? 184 BNSS. Before going for the examination of rape victim, our first priority is that we have to take informed consent. Without taking the informed consent, cannot conduct the examination of the victims. In the case of if victim will that they having no any will for the examination, in that condition we take a written refusal documentation. So either we go for the examination by taking the informed consent, or we write a written refusal documentation. So this is the first point. After taking the informed consent, we go for the history taking. In history, we ask about the age identification with at least 2 identification marks. Okay, understand. In history, what we have to ask from the victims. First, we ask about her age. Then for the identification and identification with the 2 identification mark. Then we ask about the presenting complaints like pain, bleeding, and hypertension. Then we take the history of pregnancy. Then we go for the history of sexual intercourse. In the history of sexual intercourse, we ask about the date, times, and the number of person, whether the penetration occur or not. The second question is if penetration occur, then the ejaculation occur or not. Then for the injury, then for the anal and oral intercourse, and any history of insertion, manipulation, and application. Okay, so what about the question we asked from the victims? First we take the informed consents. After taking the informed consent, we go for the history taking parts. So in the history taking parts, we ask about the age of victims. I already told you for the legal age for examination is greater than 12 years. So if the age of victim is less than 12 years, then in that condition we take the informed consents of his parents or relatives. So after taking the informed consents, we go for the history taking parts, where we ask about the age of victims and identification marks. Then we go for the history of complaint, which include the pain, bleedings, and some other things. Then we go for the history of sexual intercourse, which includes all the 4 things that mention the definition of rape under 63 BNS. What are these things? First is the penetration, history of penetration, insertion, manipulation, and the application. So after taking all these history parts, we next go for the genital examination. So in genital examination, we use 2 things. One is the GK rod, and the another is toluidine glue. So how this GK rod and the toluidine glue help in the genital examination? First, we start the topic with the GK rads. So GK rad is basically plastics or a glass rods which in are globular and they are tilted at an angle of 150 degree. So what we do with the help of this GK rod, we inserted this GK rod into the vagina. Basically, we try to see the hymen tears. So if there is hymen tear at 12 o'clock position, it indicates the history of insertion, and if there is a hymen tear at 5 to 7 o'clock position, it indicates the history of penetration. So with the help of GK rod, we try to find the victim having hymen tear or not, or hymen tear is occurred due to penetration or the insertion. So what are the use of this toluidine blue? Toluidine blue are used for the injury to identify the vaginal or the anal injury. So what happens? Vaginal epitheliums, the outer epidermis, they are anucleated. So in normal condition, when we stain with the help of toluidine blue, you can't observe any positive test. I mean, there is the staining, because this toluidine blue, they stain only the nucleated cells, and the upper layer of the vaginal epidermis, they are having no any nucleated cell. So in normal condition, the test is negative. But if the victim is having an injury, in that condition there is the tearing of the epidermis. So due to the tearing of epidermis, there is the exposure of inner layer of epidermis, which are the nucleated layers. Or this toluidine blue, they stain the nucleated layers. So in case of injury, the test is positive. So these all things are written on the boards. Presenting complaints, we ask about the presenting complaints like pain, bleedings, hypotension, history of pregnancy, history of sexual intercourse, which include date, times and the number of person, whether the penetration occur or not. If penetration is occur, then ejaculation occur or not, history of injury, anal intercourse and the oral intercourse, and the history of insertion, manipulation and application. Then we go for the genital examination with the help of GK rod and the toluidine blue. GK rod for the hymen tear examination. Insertion of hymen, if the hymen tears at the 12 o'clock position, it indicates the history of insertion, and if the hymen tear is occur at 5 to 7 o'clock position, it indicates the penetration. This is the globular heads of GK rod tilted at an angle of 150 degree, made up of glass and plastics. So what happens? Let's say this is the normal vagina. In normal vagina, there is the presence of notches. These all are the notches, and these notches are not touches the base of vagina. So this is the normal vagina. But in the case of vaginal tearing, these notches touch the base of vagina. So if notches do not touch the base of vagina, that means it is a normal notch. But if the notches are touches the base of vagina, it indicates the injury. While in case of the toluidine blue, upper epidermis layer are the anucleated, below layer are the nucleated, and the toluidine, they stain only the nucleated layer. So if toluidine blue stain the nucleated layer, that means having a history of injury. Okay, so after the genital examination, we go for the collection of swab. What are the different swab we have to collect? We collect the oral swabs, anal swab, gas swabs, and vaginal swabs. So basically, we collect 4 different types of swabs. What are these? Anal swabs, breast swabs, vaginal swabs, and the fourth is what? Anal swab, breast swabs, oral swabs, and vaginal swabs. So these are 4 swabs: oral, anal, breast, and the vaginal. So after collecting the swab at the different level, we collect some more things like the victim's clothes, taking the blood samples, foreign body, nail scraping, and 7 to 8 pubic hairs. So these all things are collected under the victim examination. So this all about the victim examination. I hope you can understand the lecture. Welcome back in next session.